So prior to Kathy and John and Sara going to FAANP with Operation Smile, the week before that, Dr. Syverud and I had the opportunity to go to Jacmel. And if you look on the map, you can see Port-au-Prince is in bold on the northern part of the small peninsula at the bottom of the screen. And if you go across to the Caribbean Ocean, you'll see Jacmel almost directly across from there. And originally, from what we've read prior to going, was a town that was mostly an artisan town in Haiti. And a lot of people thought that most of the earthquake damage was actually just in Port-au-Prince, and actually read some email accounts of people who were in the first 2 weeks of being in Haiti and sending information back and saying that, well, Port-au-Prince is in disasters and the rest of the country looks pretty good. And for most of those people, there are people who actually had not actually traveled out into some of the other area. And what we saw in Jacmel was much like what I saw on television from the news reports of what was happening in Port-au-Prince. So there was just as much destruction and damage. The other thing to think about is that as there was an overwhelming need for lodging, for food, for water in an area that had limited supplies, people actually migrated and moved to be able to try and get their needs met. So they took it upon themselves. So a lot of the rural areas actually ended up with an overwhelming number of refugees in the area that they were in. We actually went with a group called LCMS, Lutheran Church Missouri Synod, who asked for our help for their group that was going with some emergency practitioners. And so Scott and I volunteered from UVA's group because it was a short turnaround time and trying to establish whether there was someone else that could go. And we actually also flew into the Dominican Republic, and we flew into Santiago, and then we were on a charter plane actually into Jacmel. And this is the view as we came into the airport area. This area was actually within 2 days of the earthquake being secured by the Canadian military. And so they put down landing lights so that planes could land at night, and established radio communication, write the call sign on the roof of the building so that planes coming in would know what the call sign was to communicate with them. They also organized security at the port in Jacmel as well to provide some of that structure. And you can see some areas on the northern, well, I will say north as far as 12 o'clock looking at the picture now. It's actually not north, it would be west. But you can see some areas where there's white, and that's actually most of the area where the rubble was, where the buildings tumbled in the town, because the town's in the background and the port's to the left in that picture. I like these pictures because they kind of symbolize what life probably was like for many of the people in Haiti before the earthquake actually happened. A lot of the homes that were especially in the rural areas were actually adobe houses, although in the one in the front left of that picture you actually can see cracks in near the bottom, near the ground, and they had thatched roofs. In the area that we stayed in, we actually were in a kind of hotel that did have thatched roofs because the church thought that was safer for rescue workers coming in to do work. And on the bottom right is a typical picture that you see on the street. Most of the transportation is done by foot, not very many cars. When I talked to some of the hospital staff, they said their major emergency department trauma was usually foot injuries from people's feet being run over by motorcycles, as opposed to there being things that we would think about here in the U.S. that we see with a lot of trauma here. There, everybody helps. I was amazed at some of the musculature that was defined on many of the children that we took care of, because kids do manual labor, and it's a part of their life that they work with their family to do what needs to be done. And these young children are actually carrying containers full of different sized stones that would be used in doing some of the housing construction. When we arrived at Jacmel, there was a physician who actually had taken it upon herself to be the organizer of the teams coming in. And if there was a group that came in that was kind of fly-by-night that didn't really have a plan, she took it upon herself to connect them with other groups so that there was not a lot of people who didn't have a responsibility within the community. So you can see on the day that we arrived, there had been 239 planes arriving with 231 volunteers. Many of the planes were actually just bringing in food and water for people there. And this is the program that we went with, the LCMS World Relief Human Care Program. This was their first disaster relief mission. They traditionally, like Operation Smile, do programs where they go into Asia to Africa and have like a 3-month lead time to plan, to develop a team, to have people work together. And this was their first time doing disasters, and I was very impressed by their organization and the structure. From the time they gave us notice that and we accepted going with them. Within 2 hours, I had a full itinerary with complete details on what to expect when I landed in the airport, when I left the airport, what I should expect to pay for cab fare to go to the hotel in the Dominican Republic, etc. And all the details they gave us were to the letter. What we received was actually what we experienced, which was pretty amazing. So they have a good organization structure. So we were told before we went we would be working in one of 2 places. We would actually be doing work in a clinic set up makeshift in a church, or working in a hospital. And most of the work that Scott and I did was actually in the church. And this was the day that we arrived on Sunday. And you can see here they've had church service that morning with all the chairs in the church. And the lady on the left is Maggie. She was our team leader. For those of you who know about my work in RAM, I'm usually doing what Maggie does. So I had a very different role, and we were all warned before we went that we would all be stepping outside of our comfort zones. And I was really happy to be taking care of patients and not having to be responsible for everything. But Maggie did a great job of leading us and kind of telling us what the group had done before, but accepting feedback from us as the week went along as to how we might do things better. To the right, you can see 2 of our team members, the pharmacist and one of the nurses, good utilization of the pulpit to organize things, and we were fortunate that we did have a pharmacist where we were at. This is our nurses station. As you can see, crutches in the background. A lot of the medications after the first day, we decided if it was a 1-dose medication, the nurses were going to distribute it. We weren't sending patients to the pharmacy with a piece of paper saying what they needed, so we changed things around a little bit, which actually made everyone a lot happier. But we really didn't have exam tables, anything like that to care for patients on. This was the storage area, so if there wasn't something out, by about the 2nd or 3rd day, the nurses had it pretty well organized with what to find where. And this is a typical of what we see in Southwest Virginia when we do the RAM clinic, patients waiting to be seen. And so this is day 1 and day 2, arrival at the church with a churchyard full of people wanting to be seen by the team. And the church at night was actually used as a shelter. So the people who were members of the church who had lost their homes were staying at night in the shelter of the church. And many of them were sleeping in the churchyard in tents like you see here. The rest of our team worked at the Baptist Hospital in Kajak-Mel, and the pictures that you see here are the gate outside the hospital, and then inside. This is a hospital run by a American physician missionary who was not there while we were there, but has normally about 25 beds with a physician and 2 nurses that work in the hospital that are Haitians, and it expanded to 130 beds after the earthquake with tents set up on the lawn of the church to continue to care for the patients. And most of the staff was actually foreign staff working in the hospital while we were there. And after we finished at the clinic each day, we would actually go, we could do rounds, help out if there were things that were needed there as well. So I'm going to show you a few things that we saw. In a week's period of time, we had a definite course in tropical medicine. This is a young lady, 9 years old. It's the 2nd case I've seen in my nursing career. The first was in India, who had rickets and vitamin D deficiency. So something that's very preventable. Common with children with scabies as well as adults. In this little one's arm, you can see it's pretty prevalent. And we treated everyone. I had a daily discussion with the pharmacist because he would say every night when we had dinner and debriefed, like, you guys stop treating all those people for scabies. You have to stop doing that. They're just going to get them back. And I'll show you a couple of pictures that says why I treated all of them. And it was amazing. At the beginning of the week, they're like, you don't have enough permethrin, we don't have enough permethrin, but somehow there was always enough permethrin. We didn't run out. So I like to say there's a higher power that works in a mysterious way sometimes. But this is Michelle, one of our nurses, doing treatment. We did as much research as we could ahead of time, talking to a lot of the physicians at UVA who do work in Haiti to say, what are the common things you see when you just go there normally, not during a disaster?